I do this work because I can make an impact in children's lives. You get to see the resilience, you get to see the joy. In this part of Chicago, I think there's a significant need for children to have access to mental health services. There is wait lists that are 6, 7, 8 months long. Being able to make that impact immediately allows them to focus on other areas of their development in life. St. Anthony plays a crucial role in the city of Chicago. They are a community-based hospital that makes an impact locally in this diverse community. There is a significant population that we serve that is able to get their services here.
And parents grew up in the west side of Chicago. I spent a little bit of my childhood here as well. It really shaped who I am and really shaped the community that I wanted to work in. The mission of the Carole Robertson Center is to educate, enrich, and empower the community. The problem that we're seeing is that children are waiting 6 to 8 months for wait lists to receive services that are critical for their kindergarten readiness. So to be able to go to a program like Spark that does not have a waiting list, that accepts Medicaid, that removes barriers for children, has been vital for the success of those children and thinking about their kindergarten readiness. The mental health and social emotional development of children is important. We can't get to the academic piece unless we get to those building blocks. And those building blocks is being able to regulate emotions, is being able to problem solve, is being able to deal with frustrations. When working with the children, some of our work is one-on-one. A lot of it is really going into the classroom. We love to think about what do the children's need. Sometimes we're also thinking about what do the adults in the room need to really think about how to respond to children in the best way. The way we got into the partnership is that St. Anthony was already a part of our health advisory committee, and so they introduced this new program. I kind of immediately reached out to Dr. Takher to think about more of how do we create a partnership.
The Spark program was a priority for St. Anthony because that was the need that we were seeing in this community. Children going without mental health services. We talk about children's development and lifespan. If we can create resilient children, then we create more resilient adolescents and more resilient adults. If we're truly trying to make an impact in the community for many, many years to come, the focus has to be on the children. And being able to provide these services is the roots to that problem. In the time that I've been at St. Anthony, the most gratifying moments have just been working with the families and being able to see the trust that the families see the care that we give to one sibling, and they voluntarily ask us, hey, I would like my other child to receive services here as well. So being able to be that home for a patient and their families is just a truly gratifying feeling.
I really don't have words of how important it is for me and how it makes me feel. Just knowing that children are getting what they need and not just going through a cycle of figuring it out or just having to deal with these behavioral disturbances or whatever differences they're experiencing, just makes life easier for them, which makes life easier for all of us.